Imagine this. A person decides to finally clean out that old, dusty shed in the backyard. They sweep up some cobwebs, clear out some clutter, and breathe in the stale air. A job well done. They go home. A week later, they start to feel off. A fever, a pounding headache, muscles aching so badly it feels like they ran a marathon. It feels just like a nasty case of the flu. They rest, take some medicine, and wait for it to pass. But a few days after that, something changes. Breathing becomes a chore. Each inhale is a struggle, as if their lungs are filling up with water. They can barely breathe. The cause? A virus that most people have never even heard of. Hantavirus. Hantavirus isn't a single entity. It's a family of viruses, and its primary couriers are rodents. Different versions of the virus exist all around the world, causing different types of illnesses. In Europe and Asia, they typically cause a disease called hemorrhagic fever with renal syndrome, which, as the name suggests, affects the kidneys and can cause bleeding. But here in the Americas, we face a different threat. The version here causes an illness called Hantavirus Pulmonary Syndrome, or HPS, and as that name implies, this one targets the lungs. While hantavirus infections are rare, HPS can become incredibly serious, incredibly fast. It is a true medical emergency. So how does someone actually get it? This is one of the most misunderstood parts of the virus. Hantavirus is not typically spread from person to person. You aren't going to catch it from a sick friend or family member. The one exception is a specific strain in South America, but for the most part, human-to-human transmission is not a concern. Instead, infection happens when people breathe in tiny, invisible virus particles. These particles become airborne from the urine, droppings, and saliva of infected rodents. Think about those high-risk activities, cleaning out old barns or sheds, opening up a cabin that's been closed all winter, or even just sweeping a garage where mice have been living. When you disturb those dried droppings, the virus can be kicked up into the air as dust. You don't need to touch a rodent. You don't even need to see one. All it takes is inhaling that contaminated dust. In the United States, the main carrier of the virus that causes Hantavirus Pulmonary Syndrome is the deer mouse. It's a small, relatively common rodent, often found in rural and semi-rural areas. And here's the most dangerous part. An infected deer mouse almost always appears perfectly healthy. It shows no signs of illness. It goes about its life, leaving behind a trail of invisible danger. This is what makes prevention so critical. You simply cannot tell if a rodent is carrying hantavirus just by looking at it. You have to assume that any sign of rodents could represent a potential risk. If a person is exposed, the symptoms don't appear right away. The incubation period is long, typically showing up 1 to 8 weeks after breathing in the virus. And the first stage is deceptive. The early symptoms are almost identical to the flu. We're talking about fatigue, fever, and severe muscle aches, especially in the big muscles like your thighs, hips, and back. A headache is common, as are chills and dizziness. About half of all patients also experience stomach problems like nausea or vomiting. With symptoms this common, it's easy to see why most people just assume they have a common bug. They stay home, they rest, and they expect to get better. But for those with HTAN virus, this is just the calm before the storm. The virus causes the tiny blood vessels in the lungs to become leaky. Fluid starts to pour out of the bloodstream and into the lung tissue itself. The lungs literally begin to fill with fluid, a condition called pulmonary edema. This makes breathing increasingly difficult. The symptoms are a persistent cough and a profound shortness of breath. It can feel like a tight band is wrapped around your chest. Your breathing becomes rapid and shallow as your body desperately tries to get enough oxygen. At this stage, oxygen levels in the blood plummet. This is the point where emergency medical care is absolutely critical. The condition can worsen with terrifying speed, often requiring hospitalization and intensive care within just 24 hours of these lung symptoms appearing. Now, it's important to keep perspective.
Hantavirus infections are rare. Since active surveillance began in the early 90s, the U.S. has recorded fewer than 1,000 cases. Most cases occur in rural areas west of the Mississippi River. But when it does occur, HPS is incredibly dangerous. Historically, the fatality rate in the United States has been around 38%. That means nearly 4 out of every 10 people diagnosed with the syndrome have not survived. However, there is some good news. With early recognition and modern intensive care, survival rates have improved significantly. The single most important factor is getting to a hospital as soon as the breathing problems start. The sooner treatment begins, the better the chances of a full recovery. So, how is it treated?
This is another crucial point. There is currently no specific cure, no antiviral drug, no vaccine widely available for Hantavirus Pulmonary Syndrome. Treatment is entirely supportive. This means doctors focus on supporting the body's functions while its own immune system fights off the infection. In the hospital, this often involves being in an intensive care unit, or ICU. Patients are given oxygen therapy to help them breathe. They receive intravenous fluids to manage their hydration and blood pressure. Their heart, lung, and kidney functions are monitored around the clock. In the most severe cases, when a patient can no longer breathe on their own, they are placed on a mechanical ventilator, a breathing machine. For some, a machine called ECMO, which acts as an external set of heart and lungs, can be a lifesaver. Early hospitalization is the key that unlocks all of these supportive and often life-saving treatments. Given the lack of a cure, it's clear that the best treatment is, without a doubt, prevention. And prevention means rodent control. The goal is to minimize any contact with rodents and their waste. First, seal up your home. Use steel wool or caulk to plug any holes or gaps where mice could get in. Remember, a mouse can squeeze through a hole the size of a dime. Second, secure your food. Store food, including pet food, in sealed, rodent-proof containers. Third, eliminate nesting areas. Clean up clutter in and around your home where mice might want to build a nest. And if you do find rodent droppings, you have to clean them up safely. This is not a job for a broom or a vacuum cleaner. Sweeping or vacuuming is the worst thing you can do, as it sends those dangerous virus particles directly into the air you breathe. Here's the correct procedure. First, put on rubber gloves and open up windows and doors to air out the space for at least 30 minutes. Next, spray the droppings and any surrounding areas with a disinfectant or a bleach solution, 1 part bleach to 10 parts water. Let it soak for at least 5 minutes to kill the virus. Then, use paper towels to wipe up the mess, seal the paper towels in a plastic bag, and dispose of it in an outdoor trash can. Finally, clean the entire area with disinfectant and wash your gloved hands before taking the gloves off, and then wash your bare hands thoroughly. Hantavirus is a scary illness, but it's also a preventable one. The key takeaways are simple. First, do everything you can to avoid exposure to rodents and their droppings. Rodent-proof your living spaces and always use safe cleaning methods. Second, learn to recognize the early flu-like symptoms. And third, and most importantly, if you develop those symptoms after a potential exposure to rodents, seek medical care immediately. Don't wait for breathing problems to start. Tell your doctor about the possible rodent contact. This knowledge isn't meant to create fear, it's meant to create something far more powerful: preparedness. Knowing the risk, understanding the symptoms, and acting quickly could one day save a life.